Jiggers, tiny fleas that burrow into your skin, usually on your feet, can cause big problems if not removed properly. Using dirty tools like rusty pins or old needles is extremely dangerous. These tools are covered in germs, and using them pushes bacteria deep into your wound, risking serious infection. Improper removal can lead to pain, lasting damage, and even make the problem worse if parts of the jigger or its eggs are left behind. Rushed or rough removal tears the skin and increases the risk of infection. Shared or unsterilized tools can spread infections between people. Poor lighting makes it easy to miss parts of the jigger or cause more damage. A simple jigger wound can quickly escalate to severe infections like tetanus or cellulitis, which may require hospitalization. Before you attempt removal, stop and consider. Doing it the wrong way is far more dangerous than waiting to do it right or seeking help. Always prioritize safety and cleanliness to protect yourself and your loved ones. Never underestimate the risks. One careless mistake can lead to long-term health problems. Take the time to prepare and use the right methods. Avoid shortcuts. Your health is worth the extra effort. If you're unsure, it's better to wait or consult a professional. Prevention of infection starts with proper technique. Don't let a small problem become a big one. Clean tools, good lighting, and patience are your best defenses. Remember, safe removal is essential for healing. Protect yourself and your community by spreading awareness. Your health is in your hands. Treat it with care. Treating jigger wounds safely is crucial for your health. When a jigger burrows in, it creates an open wound, an easy entry for bacteria. Infections from unsafe removal can cause pain, swelling, and even spread throughout your body. Using unsterilized tools or digging too aggressively increases the risk of serious complications. Always disinfect the wound after removal. Skipping this step invites infection. Studies show most jigger complications come from poor removal practices. These infections can lead to chronic pain, disability, and social stigma, especially for children. Safe removal protects not just individuals but entire communities. Knowledge and careful practice prevent a manageable problem from escalating. Empower yourself and others with safe jigger treatment. Don't let a small wound become a lifelong issue. Take every step seriously. Your well-being depends on it. Safe treatment is a vital public health measure. Preparation is key before removing a jigger. Gather your supplies: a clean basin, warm salty water, a sterile needle or removal tool, antiseptic, cotton wool or gauze, and a bandage. Sterilize your tool by boiling it for 10 minutes or heating it in a flame, then let it cool. You can also soak it in rubbing alcohol for several minutes. Soak the affected area in warm salty water for 10-15 minutes to soften the skin. This makes removal safer and easier. Pat the area dry with a clean cloth. Disinfect the skin around the jigger with antiseptic. Use clean cotton wool to apply the solution. Proper preparation reduces infection risk. Never skip these steps, they set the stage for safe removal. Cleanliness and patience are essential. A few extra minutes of care can prevent weeks of pain. With everything ready, begin removal in a well-lit area. Use your sterilized tool to gently widen the opening in the skin. Don't dig deep. Carefully expose and lift out the jigger sac, avoiding squeezing or breaking it. Remove all parts, including eggs, to prevent further irritation or infection. Inspect the wound to ensure nothing remains. Clean the area again with antiseptic. Apply antibiotic ointment if available. Cover with a clean bandage or sterile gauze. Change the bandage daily and watch for signs of infection. Gentle, thorough removal is key to healing. Never rush. Patience prevents complications. If you're unsure you removed everything, seek help. Proper aftercare is as important as removal. Protect the wound as it heals. Safe removal means faster recovery. Even with good care, some jigger wounds need medical attention. Watch for increasing pain, redness, swelling, or heat around the wound. These are signs of infection. Pus, fever, or red streaks on the skin mean you need to see a doctor immediately. Jiggers near the eyes in large numbers or in people with other health issues require professional help. Don't delay if you see these warning signs. Quick action prevents serious complications. Healthcare professionals have the tools and expertise for complex cases. Your health is too important to risk. If in doubt, always get it checked out. Share your experiences or questions in the comments below. Your story could help someone else.